Okay. Seems like everyone is joining in now. Hi, everybody. I'm Sheng from Physio Asia Therapy Center. Thank you all for joining us on this Saturday afternoon for our webinar hosted by Physio Asia Academy. I'm excited to introduce to you two of my colleagues, Megan, who is from the Philippine branch of Physio Asia Therapy Center, and we have Shrika from the Singapore branch. Today, we'll be diving into the topic of urinary incontinence, shedding light on how physiotherapy can make a difference, and they will also be sharing some practical strategies for effective management. If you have any questions regarding any of the topic, please feel free to comment in the chat box below. And then we'll have a short Q&A session at the end as well. Okay, Shrika?
Hey, hi, I'm Shrika. So, next slide. The next slide, Megan. Okay, so we're going to talk about urinary incontinence today. I'm sure that's why most of you all are here. Tell you all how, what is urinary incontinence and how to actually manage it as well. So urinary incontinence is when you have an involuntary control of your bladder. So you can't control your bladder, urine tends to leak out, flow, causing embarrassment situations. So yeah, so a lot of y'all, it's not a very nice thing to have. All right, so next slide. Okay, so just to let you all know what is pelvic floor muscles. So I'm holding up here an anatomical anatomy of the pelvic floor. So this is where the pelvic floor, this is the spine, part of the spine, and this is the front part. And if you see the red area here, this is from the bottom. These are all the muscles of the pelvic floor. So it sits like a hammock underneath our pelvic floor girdle. All right. So these muscles are very strong, and there are sphincters surrounding there's a vagina, the anus around here. All right, the anus, and the vagina area. So this is where our urine flows out. Okay, if you can see, muscles are quite extensive. There's quite a bit of muscles around that area. So similar to other muscles, muscles can get weak. They can also get strengthened if we strengthen them, right? And if we don't use them, they tend to get weak, and certain situations also will weaken them. So we are going to show you how we can actually strengthen all these muscles up. Okay, so next slide. So there are two main types, which is stress and urge incontinence. And some of you all might have a mixture of both, which is a mixed urinary incontinence. All right, so what is stress incontinence? So usually there will be some, you get urine leakage whenever you exercise or engage in certain activities, like sports, even some of you all just bending down, getting something, there will be some kind of leakage. All right. This is also due to weak muscles of the pelvic floor and the muscles surrounding the vagina or the bladder area. Okay, and if you know that 1 in 3 women experience stress urinary incontinence in their lives, so it's a very common thing to have. And what causes this stress urinary incontinence? Okay, childbirth. Why? Because especially vaginal delivery, because the muscles around the vagina will get stretched, and this will weaken the muscles surrounding the area. So when the muscles are weakened, so it's difficult to control the flow of the urine. Pregnancy, obesity. Why? Because of the additional pressure and weight around the area. Menopause is because of the hormonal changes. Surgeries, of course, because when you do any surgical intervention, they will weaken muscles, and we will usually have to strengthen up the muscles after surgery. Neurological conditions is when the nerves around the area or supplying the muscles will get affected, thus weakening the muscles. Okay, next slide. Okay, so these are some of the activities that can cause urinary stress incontinence. Sneezing, laughing, coughing, all these activities are very commonly cause some leakages. Why? Because it increases our intra-abdominal pressure. So it presses onto that area where the bladder is. Okay, things like jumping and running are also weight bearing kind of stuff. So I think a lot of y'all, if you have this kind of stress incontinence, you shy away from exercise, but there are other forms of exercise you can actually do to prevent low impact kind of exercises as well. So don't shy away from exercises because it will get worse if you don't exercise. Next one. Okay, next one is urge incontinence. What is urge? It's when there's suddenly you feel like going to the toilet and there's no toilet around, and you know you can get some embarrassment, like some the urine will come pee will come out or something like that before you even reach the toilet. So because of this, you tend to want to frequently visit the toilet before you even feel the urge, you know. But if you actually, a fact is that a healthy bladder can actually hold up to 800 milliliters of urine. So if you imagine your water bottle of 1 liter water bottle, that amount of urine you can actually hold. But because we tend to want to void early to avoid this urine loss, that so the bladder will tend to learn that, you know, with 200 300 ml of liquid, it will void, then you will tend to want to they will have that urge to go to the toilet. Yeah, so what causes that urge? Age, of course. If you get older, there will be more frequent visits to the toilet. Neurological conditions, nerve damage and stuff like that around the area as well. And things like coffee and tea, they are diuretics, so they tend to make you go to the toilet more often. And of course, stress provides tension, gives tension to the muscles that we have, even to our pelvic floor muscles as well. So poor bladder habits is what I was talking about. Going to the toilet ever so often, like every 1-2 hours. So actually we are normal number, average number of toilet stops in a day will be around 6 to 8. So yeah, so if you're going to the toilet every hour or every 2 hours, it will be a bit too much. Then the bladder will tend to learn that, you know, oh, this is normal, and you keep on wanting to go to the toilet ever so often. And also, of course, the weakness of the pelvic floor muscles. So that can cause the urge of the incontinence as well. Okay, so I think Megan will be going through the management. Oh, sorry. Some of y'all might actually get both. So there's mixed urinary incontinence. So you can have both stress and urge incontinence. Okay, so there will be involuntary because of physical exertion, or even you will get the urgency. All right. So Megan, you will be talking to us about the roles of physiotherapy.
Yeah, so the role of physiotherapy in urinary incontinence. So what is women's health physiotherapists? So physiotherapists, these are physiotherapists who had undergone specialized training in women's health. women's health physiotherapists also provide assessment and treatment of the pelvic floor muscles. So the role of the physiotherapist in treating urinary incontinence is to provide a thorough assessment of the patient's condition for us to give effective treatment plans. Because sometimes if the patient doesn't know how to contract or lift their pelvic floor, the exercises the exercises given won't be enough to treat the condition. So it is also a guide to patients to manage their symptoms through targeted strategies. So with the help of women's health physiotherapists, patients with incontinence are able to treat their symptoms in proper ways. So for us physios, to assess properly or to know the condition, so we have different types of assessment that we give to our patient or that we do to our patients. So to assess the patient condition, we do external examination, internal digital examination. So we use the fingers. We use our fingers to examine the pelvic floor or like the vaginal canal. But we only use one or two fingers. Also, we use manometers and dynamometers, the use of real-time ultrasound, and the use of MRI or EMG. So EMG is used as a good biofeedback for the contraction of the pelvic floor, but it doesn't measure the strength. For the MRIs, physios doesn't usually use the MRIs because it is done by other medical healthcare workers. It is clinically also expensive and it is not widely used to assess the pelvic floor muscles. Okay. So here for the external assessment, the physios, we check the anus contraction. So for the female, we have here the anus, and for the male, we have here the anus. So we check the contraction of the anus. We ask the patient to lift the pelvic floor, which is like holding your pee. Or we can also ask the patients to do double cuffing. So you will see the contraction of the anus when you do that double cuff. But since this is not enough to check the strength of the pelvic floor muscle, internal digital assessment is done. So for the internal assessment, so based on the picture, the physiotherapist is using two hands to palpate or to feel the vaginal canal or the pelvic floor muscle. So in this internal assessment, there is this five ways to assess the pelvic floor. So we have the power, the endurance, the repetitions, how fast or the speed, and every contraction time. So for the power, we assess how strong or weak your pelvic floor muscle is. So we use this modified Oxford scale to grade the pelvic floor muscle strength. Okay, so for the endurance, this is where we test how long the patient can hold the contraction up to 10 seconds. So we ask the patient to lift the pelvic floor or hold the pee, and then we ask them to do we ask them to hold for 10 seconds. If the patient cannot hold, then you just have to do it. And then for the repetitions here, it is assessed on like how many contractions can the patients hold with rest in betweens up to 10 repetitions. So we do not want to tire the patient during assessment. For the fast, this is where we assess how fast or slow can a patient do one full contraction. When we say one full contraction, when the patient can lift the pelvic floor muscle, and then when can the patient relaxes the pelvic floor. So that's one full contraction. And every contraction time is just a reminder to every time contraction. Then next, the tools we utilize during the assessment. So we have different tools to assess the pelvic floor muscles. So we have here the manometers, the dynamometers, we also use real-time ultrasound imaging. Excuse me. So for the dynamometer, manometers, these are reliable tools that can measure the pelvic floor muscle contraction as it has the gauge or like the pressure. It shows the pressure of how strong your pelvic floor is. So here we use in the clinic, we mostly use is the real-time ultrasound imaging. So the real-time ultrasound imaging is widely used as it provides a good visual feedback for patients to use as a means of contracting or lifting their pelvic floor muscles correctly. So this real-time ultrasound imaging is also non-invasive, valid, and reliable tool. It is used by simply placing the ultrasound probe just below the navel. And then the examiner can evaluate both the squeeze and lift of the contraction, unlike the manometers and the dynamometers, which gives the numbers. The RTU cannot measure the strength, but you can see the contract and relax and the endurance of the pelvic floor muscles. And it can be accurately evaluated. Okay. So next slide is I'm going to show you a video of a pelvic floor muscle contraction. So in this video, you can see the bladder. So this is your bladder. So this is your bladder. And this one, the floor, is your pelvic floor muscle. As you can see how the pelvic floor muscle lifts as it contracts. So you see this one, it lifts. So it means it's contracting and it relaxes as it falls down. So this is how your bladder looks like. Not everyone has this shape of bladder. Some has a smaller one, some has a butterfly shape. So everyone has a different shape and sizes of bladder. So as you can see again, I will play again the video. So here, as the muscle contracts, the pelvic floor lifts and relaxes. So there. So for the next slide. So how can a physiotherapist help to improve urinary incontinence? So here we do exercises. Pelvic floor muscle training. It is also known as Kegel exercises. Most people know this exercise is called Kegels, but as physiotherapists or as women's health physiotherapists, we don't call it Kegels, as Kegels is the doctor who invented the exercise. So we use pelvic floor muscle training. So it is a set of exercises that involves tightening or lifting of your pelvic floor muscles. Physiotherapists may incorporate this action or this pelvic floor muscle training alongside other exercises such as pelvic bridging. So while we are doing the pelvic floor muscle training, we can also do bridging together with the pelvic floor muscle training. So when you lift your pelvic floor your pelvic floor muscles, you can also do bridging. You can do bridging like sit-ups. You can also do straight leg raising, etc., etc. So it's up to the physiotherapist to be creative with the exercises that it can incorporate pelvic floor muscle training. For the patients, before you do all these exercises, just a disclaimer, it's better that you see a women's health physiotherapist or a pelvic floor muscle physiotherapist specialist for you to be able to do your exercises properly. So here, we also use, for the treatment, we also use pelvic floor muscle biofeedback or the real-time ultrasound machine. So this machine is a non-invasive technique. As I've said earlier, it allows both patient and physio to get a better biofeedback or a better view on the patient's pelvic floor muscle contraction or lifting and for better activation. So this one is used to like as you can as you saw earlier the video you saw how the pelvic floor lifts and relaxes, right? So in training the pelvic floor muscle, the patient can see how like if he is doing or she is doing the exercises correctly or if the patient is not doing the exercises correctly. So you will see if the pelvic floor will move or not, like if it will lift or if it will not. So the exercises is done repeatedly until the patient learns how to do it correctly. Also, the use of real-time ultrasound is not just for strengthening of pelvic floor. This is also used for those who are having difficulty emptying their bladder or having difficulty peeing. So the use of a real-time ultrasound can help relax the tight pelvic floor muscles. Since you can, as you can see, the contraction, the relaxation, um, the the real-time ultrasound can give the patient a good feedback if he or she is doing the relaxation properly. Hmm. So another exercises that we can do or we can give to the patients is posture and breathing correction. So women's health physiotherapists will aid in diaphragmatic breathing, not different types of breathing, but we use the diaphragmatic breathing or deep diaphragmatic breathing to relax the pelvic floor muscles, reduce the pressure on the bladder, and to improve muscle activation on the pelvic floor. Okay. In order for the patient to relax the pelvic floor muscle and improve muscle flexibility, we do this breathing exercises. So in this picture, you can see here, if you do diaphragmatic breathing, it pushes down your pelvic floor muscles here. It relaxes the muscle to accommodate the increased pressure in your abdomen. Because when you breathe using your diaphragm, so your diaphragm sits here, it expands your stomach here. And when you expand, it gives downward pressure here to your pelvic floor. It also decreases, the pressure on your bladder, helping you to empty the bladder. So what's happening is when you breathe in as well, it's like opening the doors. And when you breathe out here, the pelvic floor should be going up and closing the door. So I will be doing a demonstration of a proper breathing exercises. So when you do the breathing exercises, so you can also have a good feedback. You can use your right hand or your dominant hand on your chest or on your stomach, and then your other hand on your chest. And then you will feel that your stomach should be the one moving, not your chest. So this one should be relaxed. A good position should be a lying position, and your patient should be relaxed, very relaxed. Your shoulders must be relaxed onto the table. So here you hold your chest, you feel your chest, and then you feel your stomach. And then when you breathe in, your stomach should be the one moving, not the chest, not like this, but the chest, but the stomach. Sorry, I can't show this part. Anyway, so he should be teaching, the physio should be teaching that to your patient to be able to do the correct way of diaphragmatic breathing. So next is, the treatment tools that we use in treating pelvic floor muscle. So we use this pneumatic pelvic muscle training. So I have here an example. I have here the muscle trainer. So here you can see. So there is a test, and there is a train. So this machine, it inflates automatically up to you decide. This is the probe which is inserted to the vaginal canal. Okay, so this one, if this is inserted, to the vaginal canal, it automatically inflates. So this one, it inflates to 55. So this is in test mode. So you can do a test mode or a train mode. Later on, I will show the train mode. So for the test mode, so it says here, relax. So you can test your muscle to relax. And then later, after a few seconds, it says flex. So you can like give pressure, like here, I'm giving pressure. So there you can see there's 100. And then when you relax, it goes down to 55. So that's how you test if the patient has a strong pelvic floor muscle. So relax. If the patient can also relax properly, it will go down to 55. So for the test, so that's for the test mode. For the train mode, wait. So here for the train mode, same. This one is inserted to your vagina, to the vaginal canal, and then it will inflate on as how the pressure inside the canal. So this is the pressure is set to 55. So here you will be doing like the training and then hold for a few seconds. It says train, train, train. Later on, it will ask you to relax. So you have to train, train, train. And when I'm decreasing the pressure, there. So this is how you train your pelvic floor muscle. So there. So next one is the here. We also use the biofeedback pressure cuff. Um, this one is used to isolate the accessory muscle, like your abdominal muscle. Since abdominal muscles is just near your pelvic floor muscle. Some patients they use the abdominal muscle instead of pelvic floor, as if I mean if the patients are not aware on how to lift their pelvic floors, they're using the accessory muscles, which is the abdominal. So this one biofeedback pressure cuff is used to isolate and recruit specific muscle for the pelvic floor. So this tool is used to train the pelvic floor. The pressure should be controlled. So there is like a cuff or like a gauge here, like here, and then here's the cuff, which where you can inflate. And then if you want to train your pelvic floor, there should be minimal or controlled increase in pressure. Because if you will be using your abdominals, the pressure on this cuff or like on this gauge will shoot up quickly. So that's the visual feedback that your abdominal muscles or accessory muscles are the ones activating. This is also used to train posture and back. So for the next treatment tools, we have here the EMG here, plus the EMG triggered electric stimulation. So this tool is used to train the pelvic floor muscles with or without electric stimulation. If the patient has just a grading of, let's say, 3 or 4, you can use it without the electric stimulation. So I have an example of the vaginal canal, of the vaginal probe where we also use. So this one is also used to insert into the vaginal canal, and then the machine here. So we use this one here, and then we train the pelvic floor. So the physiotherapist will show some images where you can imagine that your pelvic floor is lifting. So here, I can show you here example of a rose that is relaxing. And so here, as you can see, it blooms there. So it gives you time to rest or to hold and then later on it will shrink. So that's how the EMG biofeedback works. So this one, when the flower blooms, it means you should contract or lift your pelvic floor or contract your pelvic floor. So later on, if it shrinks, it means you have to relax it. So you relax your pelvic floor. It is also a good visual feedback for the patient. And then if the patient has a very weak pelvic floor muscle, we incorporate electric stimulation. It helps stimulates the nerve to help strengthen the pelvic floor muscle. So this one is a good biofeedback for the patient because the patient will feel the electricity. So it's like a signal or cue that they have to lift their pelvic floor. Same goes with the electrical, neuromuscular electrical stimulation. So same, like if we have to give stimulation to the pelvic floor muscle, so it stimulates the nerve and to strengthen the pelvic floor muscle. So what are the strategies that we can adopt in treating pelvic floor muscle or urinary incontinence? So here we have the bladder diary. So a bladder diary is a very helpful tool for a patient since it tracks the amount of urine you pass every time you go to the toilet and every time you leave. So here's an example of bladder diary. Later on, Shang will post the link for the bladder diary. So this is a helpful tool for the patient who has incontinence. So this is it gives the clear picture of the pattern of leaking function, pattern of leaking function through the day and night. So in with this bladder diary, you have to record your urine input and output through the day like for 3 consecutive days, 3 days and night. So it includes any effects of the fluid that are bladder irritants such as carbonated drinks and coffee. So this bladder diary is about recording 4 important things. So we have the input. So the input here, wait, I hope you can see. So here, in this bladder diary, there is this fluid intake. So here is the input. So you record all the fluid that you drink. It also includes the food that are mainly liquid, like soup, jellies, custards, and the like. So not only liquid, not only drinks, but also food that are fluid. So for the output, you have to record the amount of urine you pass over at least 3 consecutive days and nights. So here, yeah, amount of urine passed. Okay. So you will be measuring it using a large container that has a measure like for example, like you use mil or cup like that. And then for the leakage, the record of amount of any leakage of urine. Let's say, for example, like a spotting, a few teaspoons, like if it's a blood or similar description. So here, if there is a leakage episode, here, if it's small, medium, or large. So we also record that. And for the last one is the circumstances. It is where you're or what you were doing at the time of leakage. It is very important information, both for your own awareness and continence assessment. So the circumstances includes whether you felt an urge, like sudden need to pee just before the leakage happened, or if you leak when you cough or while lifting. Let's for example you're doing exercises. Yeah, those kind of circumstances. Mm. And so that's for the bladder diet. So next is for us to treat the incontinence, urinary incontinence, we also do the bladder training. So for the bladder training, examples are like voiding prior to engaging in any strenuous activity. So you have to train your bladder as well. You have to schedule your trips to the toilet. Let's say, for example, if you can hold your pee for like 2 hours, or like what Shrikar said, you're not your bladder. I mean, since your bladder is like trained, let's say for example that you go to the toilet every, let's say, 3 hours, not every hour. So I also have to do bladder training. Decrease fluid intake, also to avoid certain beverages. So next is the strategies, mind over bladder. So as what I've shown earlier, like the imagery or visualization, earlier I have shown you a video or like the biofeedback, using the biofeedback of a rose. So here you can imagine that when you lift your pelvic floor, you're like opening and closing this flower petals. So so we use imagery or visualization. It helps to establish a better connection between the mind, bladder, and pelvic floor muscle whenever feeling sudden urge to urinate. Um, Here are also some good examples. And there's a flower, the opening and closing of the petals. Also, using a marble, you imagine your pelvic floor lifting, like you're picking up the marble, and then you're slowly letting go of the marble. It's also like with the pasta, like when you like imagine your pelvic floor getting the pasta and then like letting go of the pasta. And then for the elevator lifts, we can also use this imagination, like you're riding the elevator going up like that, like your pelvic floor is like lifting like the elevator, and then when you want to relax, the elevator goes down, or the lift goes down. So it's also like with the trap door, if you can see the door going up, it's opening. So it means you're contracting the pelvic floor, and when it closes, you're relaxing the. So yeah. So those are the strategies that you can use or that can help the patients with urinary incontinence. Thank you. Okay, so Shang.
Megan, you want to click onto the next slide for me, please?
Yeah.
Yeah, so we have some question and answers right now. So, but I can see on the chat, if you have any questions now, everyone can type on. If there's no questions, we can move on to the next slide, which Megan will also cover, but we'll just wait a little longer if anyone has any questions. Yeah, so unfortunately we won't be having a handout of this presentation, so I'm so sorry. But we did record it, so we'll see if we can post it somewhere at some point, and we'll let you know. Yeah. Okay. Is there any other questions? If not, we can move on. I think we can move on, Megan.
Sorry. Okay, so for those patients who are experiencing urinary incontinence or like the bladder incontinence, you can visit Physio Asia Therapy Center in these branches. So we have 3 branches, one in the Philippines, 2 in Singapore, and 1 in Malaysia. So in the Philippines, you can visit us at Unit 2205, Centuria Medical Makati, Kalayaan Avenue, Makati City. In Singapore, you can visit them at the Orchard and Siglap branches. So in Orchard, they have the International Building, and in Siglap, a Siglap Center. And in Malaysia, you can visit them at Montiara, Kuala Lumpur, Malaysia. Dang.
Yeah, so I will be attaching a feedback link in the chat box as well. And we have received some requests from some of you, I think especially some from the Philippines as well, who would like an e-cert. So I did attach the link in the chat box as well. If you would like, you can fill out the form there as well. Yeah, so can you click to the next slide? Yeah, so this is alternatively, you can scan the QR code as well. So yeah. Thank you everyone for attending our webinar. We finished a bit earlier, but hope you all learned something new. So thank you and have a good Saturday and Sunday.
Thank you.
Thank you.
Thank you.